Now, for the next of which we'll be discussing about is what is known as the colorectal carcinoma. Colorectal carcinoma. So when you hear the colon, they are talking about the intestines. Most of the times, the small intestine. When you hear rectal, of course, that's the rectum. That's the inside of the anus. So you can have carcinomas around that side of the small intestine down to the rectum. Alright? So let's talk about it, what can actually cause it. Okay, just like I told you guys, colon is usually from here to here, while rectum is basically the inside of the anus. So colorectal carcinoma is just malignant tumor of the colon or rectum. It's one of the most common cancers worldwide, with a leading cause of cancer-related deaths. So it arises from epithelial lining of the large intestine. Alright, so colon can also be the large intestine, but you can see that most images will carry it that there's actually issues in the small intestine, right? But it can also occur in large intestine. So it progresses from precancerous polyps, where the issue is benign, to what? Malignant issues, right? So prevalence is the third most common cancer globally. Imagine, accounting for about 10% cases of all cancers. Mortality, second leading cause of cancer-related death. Of course, one of the complications there could be that the drugs they are using to treat, the chemotherapy. Then also, how will I put it? If the cancer spread to the respiratory system, all right. So age group mostly affects individuals that are age 50 and above. So global body in 2020, about 1.9 million cases were discovered. About 930,000 deaths were reported. So factors. Lifestyles. You have taken high processed foods, okay, low intake of fruits or vegetables, sedentary lifestyle, obesity, if you smoke, if you take alcohol. All of these, they have their different ways of putting up colorectal cancer. Then sometimes we have inherited disease conditions like the familial adenomatous polyposis, the Lynch syndrome, right? Then other conditions like inflammatory bowel disease, the ulcerative colitis, the Crohn's disease. If you leave them, they now keep going up till they become cancers. So pathogenesis, we have the adenocarcinoma sequence, where most colorectal cancers they develop from adenomatous polyps through accumulation of mutations in the APC gene, in the KRAS gene, in the TP53 gene. So microsatellite instability pathways is seen in Lynch syndrome and sporadic cases with mismatch repair defects. So clinical features is there's change in bowel habits, blood in stools and abdominal pain, unexplained weight loss and anemia. So location specific signs is there's right-sided tumors, there's occult bleeding, iron deficiency anemia. So if it's on the left-sided, right-sided, let's see, my right side is this side. So right sided is large intestine, left sided is small intestine. So left sided there's obstruction and there's altered stool caliber. Okay, so diagnosis, all this colonoscopy, fecal occult blood test, stool DNA test, images like the CT colonography and MRI scanning. So treatment, if there's a risk of the cancer spreading, they could just resect the colon, so colonectomy. All right. Then sometimes they use chemotherapy, targeted therapies, and the rest of it. All right.